Welcome, Dr. Locke. Thanks for checking in with us again. Just looking at the latest numbers in our region, I see in the last week or so we're averaging over one new case per day. Do you know how many tests that we're averaging per day?
So tests are done in various places. They're done in the hospitals for the inpatients and the emergency departments. They're done in the assessment centers, and we do tests. And then there's a few family doctor places that are doing tests as well. So we know how many we're doing, and we report those on our website. And then we also get reports regularly from the labs in London, and the numbers they're doing, but those are tests from everywhere in the western part of the province. So I don't know exactly how many we're doing, but we do know from the lab in London that there still is some additional capacity, and we're quite happy about that. So that means that we can continue to try and test more and more people.
And how realistic do you think these numbers are? I mean, initially people were told to stay at home if they had symptoms and to only seek assessment when they were experiencing difficulties.
Yeah, so because the situation in order to do with a test is getting better, we have the swabs. We're still a little tight on the reagents, so we can't go all out crazy yet. But yes, we're definitely doing a whole lot more testing. And as directed by the Premier, and with our focus is really now on vulnerable settings. So we know that we are not able to test everyone, but the vulnerable and the elderly, the ones who do get the sickest, do end up in our healthcare system somewhere. And so they do give us at least an idea of what's going on. So we sort of take those numbers and we think, well, this is maybe the top half of the iceberg, and we have to expect that there's still a lot more cases out there, and that we're only getting a partial picture.
Understand. On Monday, you released your new weekly surveillance report summary. Has there been requests for this type of a report, and how can this help residents?
We are constantly looking at ways to help our community citizens better understand what is going on. So sometimes it's a little challenging to translate surveillance data and testing data into something that's easy for our community to understand, but we keep trying, and we thought that this infographic made it clearer. It also helps other of our partners to understand better. So if people are working in various sectors and trying to figure out how is this COVID outbreak going to affect me locally, they can use our data if they understand it, and then they can use it incorporating and making their own planning decisions. So we're trying to help people understand what's going on, just so they know, and also so they can do better planning.
And this report shows a model using doubling time. Can you explain this?
Yeah, doubling time is an important indicator that we use to keep track of whether we're keeping this outbreak under control or not. If the double time goes, it's like if it becomes shorter, that's bad news. So when the doubling time means that that's the number of days it takes to double the number of cases. So if you have a doubling time of 3, then every 3 days your numbers go from, let's say, 10 to 20 to 40 to 80. So if your doubling time is short, your numbers are going up very fast. So what we're quite happy to see is that our doubling times have been getting longer. So we started with a doubling time of 3, so our numbers increased twice as much every 3 days, and then we went to 5. So that was good, and now we're up to 10. So that for us points to the fact that we may actually be getting a little bit of flattening of the curve going on. Now we still have our fingers crossed because we know we're not testing everybody, so not everybody's showing up in those numbers, but we're still getting an increasing doubling time, even though we're able to test a lot more now than we were, let's say, 2 weeks ago. So all in all, that's good news.
Great. Now, St. Thomas Hospital has just opened an assessment centre. What's the process there for testing?
So that's the assessment center is part of a system that we've put in place. And the system starts with you as a citizen going to our website to start with our self-assessment tool. Or you can go to Covid-19checkup.ca, and that will get you to the same self-assessment tool. And that self-assessment tool is the self-assessment tool that's being used by the province, but it's linked into a local software package that connects that self-assessment to many of our local family doctors and nurse practitioners. And so when you do that self-assessment tool, you get connected with a local primary care provider who will determine whether you need to be tested or not based on your self-assessment, and that primary care provider can then book you in for an appointment with the assessment center. So you can only get to the assessment center for testing if you have an appointment, and you can only get an appointment if you start with doing the self-assessment tool with your family doctor or your nurse practitioner or just online.
Okay. Do you think there are some patients with other health concerns that are avoiding the ER because maybe they're worried about contracting COVID-19?
We are concerned that that is happening, and we're really glad you brought that issue up because we do want to remind citizens that our emergency departments are a safe place to go. They have lots of procedures in place, and everybody's been trained so that they can avoid spreading infection from one patient to another. So if you need to go to the emerge, let's say you have chest pain or you've hurt yourself in some other way, or whatever health problem you have that you really feel needs to be treated by the emergency department, we do encourage you to go there. We don't want to miss managing a stroke or a heart attack or other problems like appendicitis just because you were fearful of going.
Last week, the province announced new safety protocols for long-term care homes, such as increased testing for residents and staff. Who oversees these requirements?
We at Public Health have a long-standing, ongoing collaborative relationship with our long-term care homes. We're always trying to keep them free of outbreaks, particularly in the winter when all these cold viruses are going around. So Public Health knows our long-term care homes and retirement homes well, and our staff know each other. And so now we're going to work together more carefully and more thoroughly to start making sure that everything is top-notch in all of these homes to prevent infections from getting into them. And also we'll start to work together to figure out how to do the testing. Now, there's a lot of residents and a lot of staff in all these homes, so testing them all is a big job. So we are going to be trying to engage other community partners, such as the paramedics or the hospital or long-term or home care, and we're going to work together to ensure that we have sufficient resources to do the testing. Because we always test with every outbreak, that's normal work, but doing all of them at sort of in quick succession will be quite a big job. And so we'll probably call on our health system partners to help us out.
I understand. Now, the federal government has made allowances for seasonal workers to enter the country. What protocols are there for those workers entering our region?
Our seasonal workers are very important to us all, and we're thankful that they're here and help us to harvest the food that we need so we can all eat well. That said, we do want to be sure that they are safe from getting infection, and we are safe from getting an infection from them. So the same rules apply to those workers as to any traveler coming to Canada. So they all have to be in isolation for the first 14 days to be sure that they are not carrying disease with them. And we have been working carefully with the farmers, and the ministries of the province, various of them have been working with the farmers as well. So they have received lots of guidance instructions on how to do the self-isolation. I know the Ontario Hotel Association has been offering hotels where they can send people to if they don't have enough spaces on the farm. And we are also working with the farmers, so even when they come out of isolation, that they know that they have to stick with the physical distancing, and we encourage them to find ways so they, again, only make one trip a week to the grocery store for the whole group of them, and have one person pick up all the groceries. So we're asking them to do all the same things we're asking all our Canadian and Ontario citizens to do. And then we're actually helping the farmers and the workers by trying to provide things in guidance documents in Spanish and in English so that the workers can read them and understand, and that the farmers and the workers can work together to come up with solutions to help us all stay safe.
Great. And is there anything else you'd like to add today?
Just congratulations to everybody that we are looking like we are flattening the curve a little bit, and that's due to the hard work everybody's been doing. Keep it up, and keep each other safe, keep our loved ones safe, and we'll get through this.
Great. Thanks for your time today, Dr. Luck.
You take care. Bye now.
Bye.